and thank you for joining our Fall PCLP Colloquium. The focus of today's discussion will center around women's reproductive and neonatal health. Women remain a critical part of the healthcare infrastructure, both as partakers of healthcare services and as providers. Today, our young physicians in training will underscore the critical role of women's healthcare issues in the healthcare arena while highlighting the importance of screening, access, and education. Thank you again for joining us. Enjoy the presentations.
My name is Monica Branch, and I attend the Chicago Medical School at Rosalind Franklin University of Medicine and Science. I completed my PCLP internship at Legacy Community Health Services in Houston, Texas, and my project is called Stop the Spread, Geographically Tracking the Syphilis Outbreak in Houston and Harris County. In 2012, the Houston Department of Health and Human Services declared an outbreak of syphilis infections in Houston and Harris County. And at the Legacy Community Health Services clinic specifically, they've noticed a sharp increase in the number of syphilis infections coming to the clinic, particularly among men who have sex with men. And so we were interested in identifying where these individuals are coming from, specifically locating them geographically in hopes to identify some patterns or trends, and then further explore those trends to see what their social and sexual networks are that are facilitating this sharp increase in prevalence of syphilis. And so the objective was to identify the prevalence of syphilis infections by zip code in the Houston and Harris County area and assist the Legacy Education and Prevention Department in deploying resources and efforts to provide education and screening to high-risk populations. And so what I did was I performed an inquiry of their electronic medical records called Centricity, and I identified all syphilis diagnoses by their ICD-9 code in all Houston zip codes. And then I created a map that highlighted which areas or which zip codes had the highest number, specifically greater than 29 cases of syphilis. And so in the inquiry, I identified the cases by zip code, but then also by gender, by race, and then also ethnicity, and then also whether or not they were HIV positive. And so some of the key findings were there were 10 zip codes in the Houston, Texas area that reported greater than 29 cases of syphilis. The highest number of cases were within the 77006 zip code, and they reported 98 cases, and those were particularly among males that were also HIV positive. However, the majority of cases throughout Houston overall were among HIV positive black males, and they were not within that 77006 zip code. They were in other geographic areas that the Education and Prevention Department are not targeting in terms of education, screening, and prevention. And so I would recommend that Legacy would expand their screening and prevention methods to these other high-risk populations that are predominantly black communities. And I would also encourage them to facilitate or to provide more aggressive preventive initiatives to these high-risk communities to prevent HIV infection. Thank you.
In 2011, funding for women's health care in Texas was severely cut, leading to a large demand for both family planning services and prenatal care. Texas Women's Healthcare Coalition estimates that unplanned pregnancies in Texas make up for $1.3 billion annually in Medicaid costs, and approximately 47% of pregnancies in Texas are unplanned. Undocumented women in South Texas also have been greatly impacted by these cuts. These women have had very limited access to affordable prenatal care and frequently would start prenatal care very late in pregnancy. In November of 2013, the Expanded Primary Health Care, or EPHC, grant was created by the Texas Department of State Health Services and awarded to several clinics throughout the state of Texas with the goal to help provide preventive care to women, as well as decrease the rate of unplanned pregnancies. The EPHC grant expanded eligibility for coverage beyond state Medicaid to women aged 18 and above with incomes up to 200% of the federal poverty line, as well as more relaxed requirements for legal U.S. documentation. The aim of this study is to measure the effect of the EPHC grant on family planning services as well as prenatal care to see if making insurance available would increase usage of services and impact the goals of the grant. To do this, EHR data for women aged 18 to 44 was reviewed from the time of implementation of the EPHC grant to present to measure the total number of family planning services over the time period, the gestational age at the first OB visit, as well as the birth weight of babies when born. Results showed overall increases in the number of family planning visits over the time period, indicating that having available insurance coverage for contraceptives may be increasing the number of family planning visits. Results also showed that the number of first OB visits late in pregnancy decreased over the time period, and women starting prenatal care in first trimester steadily increased at the same time. Data for birth weights over the grant period was less conclusive and showed no clear trend. This may also be due to the fact that many women who have delivered over the grant period likely would have had their first OB visit before the grant was implemented. Overall, the results show a positive impact potentially due to the EPHC grant, and future work could be done to compare rates of these visits from last year to this year. Recommendations would be that the state of Texas continue to fund the EPHC grant in order to increase family planning usage as well as positive birth outcomes.
Hello, my name is Anita Sama, and I'm a medical student at Loyola University Chicago Stritch School of Medicine. This summer, I served as a PCLP scholar at Spring Branch Community Health Center in Houston, Texas. The title of my project was Prenatal Care Program Evaluation and Guide. The objective of my project was to support the development and implementation of supplemental services in the prenatal program. Specifically, I was to develop trimester-specific and culturally sensitive patient educational materials, develop a syllabus and program guide for the prenatal classes, and identify partnerships and resources to enhance the program and establish a new class. Methodology included utilizing the American College of Obstetricians and Gynecologists book, Your Pregnancy and Childbirth Month to Month, to develop the trimester-specific handouts. The content was completed working in partnership with the midwives, translated into Spanish, and design and printing of the brochure was contracted to an outside company. The March of Dimes Becoming a Mom Comenzando Bien curriculum was selected, and opportunities to fund program goals and partner with different agencies in Houston were identified. Expected outcomes include that the trimester-specific handouts will support patient education by covering important information and common patient concerns in a concise and reader-friendly manner, that utilizing the Becoming a Mom curriculum will allow for immediate implementation of a center-sponsored inclusive prenatal class with hopes that at least 50% of prenatal patients participate. Now, as a Vitamin Angels field partner, Spring Branch Community Health Center will be able to provide free prenatal vitamins to their patients. This partnership ensures a 3-year commitment from Vitamin Angels, and the first shipment included 12-month supplies of prenatal vitamins for 660 women. And also, local relationships with Spring Branch WIC, Life Houston, which is an emergency formula assistance agency that has served Houston for 20 years, La Leche League, which is a breastfeeding subgroup, March of Dimes, Nurse Family Partnership, and Coles Cares will enhance program activities by providing much-needed educational and other resources. It's recommended that Spring Branch will utilize the 2014 March of Dimes Community Grant Award of $2,000 that we received in July to implement the new prenatal course using the Becoming a Mom curriculum by the anticipated start date of August 20th, 2014. It is recommended that Spring Branch will also apply for more national funding through March of Dimes to further strengthen and establish the class at the center, and that the clinic will continue to foster strong partnerships with Houston area organizations to provide resources for prenatal patients and patient education.
Good afternoon. My name is Fanshawn Montgomery, and I'm a second-year medical student at Meharry Medical College in Nashville, Tennessee. The title of my project is Sudden Infant Death Syndrome Awareness in Relation to the Perceptions of African American Women. The objective of my research is to assess each patient's current knowledge as it is related to sudden infant death syndrome, also known as SIDS, and how it affects decisions correlated to SIDS. SIDS is the leading cause of death among infants aged 1 month to 1 year. Although SIDS affects all communities, African American infants are twice as likely to be affected compared to their white counterpart. While there has been a decrease in the number of SIDS deaths, Mississippi is still above the national average in SIDS cases. So the method of my project was patients who identified as African Americans and who were between the ages of 18 and 66 were asked to participate in this study. Each patient was given a pre-survey to fill out before an informative presentation regarding SIDS, which was adopted from the resource kit of reducing the risk of sudden infant death syndrome in African American communities sponsored by the Back to Sleep campaign. This presentation included what is SIDS, the cause of SIDS, SIDS myths and facts, and what can be done to reduce the risk of SIDS. After the presentation, participants were engaged in dialogue in order to ask questions and discuss their viewpoints. After the open discussion, each patient took a post-survey. Each question has been grouped into 4 perception categories, such as previous learning, previous experience, attitudes and interests, and needs and feelings, in order to see if perception plays a role in how African American women view SIDS. The key findings are incomplete at this moment, but it is expected that although several organizations in Mississippi have taken initiative to educate mothers and caregivers on reducing an infant's risk of SIDS, there is still a need for more education and awareness in reference to SIDS in order to understand different perceptions and beliefs concerning SIDS.